year of genomic surveillance has revealed how low rates of vaccination in Africa could lead to vaccine-evading mutations of the coronavirus. A study of genomes from 33 African nations and 2 overseas territories has tracked the evolution of the pandemic across the continent. The research is the first major output by Africa's leading scientists in an effort to increase the continent's ability to produce and analyze genomic data. Professor Tule Vera was part of that team who published the data, and he joins me now from Durban. Of course, Professor de Oliveira is from CRISP, which is the Research Innovation Sequencing Platform hub linked to the University of KwaZulu-Natal. Professor, so this is interesting. South Africa, as we know, is a leader in keeping an eye on the genetic mutations of COVID-19, but we've now got this broad picture of what is happening with the movement of COVID-19 and the development of variants. If you could sum it up in simple terms, what would you tell us?
Yeah, good evening, Sally, and good evening to all your viewers. Yeah, so what we did, and that always started in South Africa with funding from our Department of Science and Innovation and the MRC. We first put a national consortium in South Africa, and then we expand all the technology and the analysis to the whole African continent. Yeah. And we are quite excited about that. It took around 20 weeks of work to analyze all the data, but we managed to work with 122 African organizations, over 310 scientists, to try to really understand the genetic diversity of SARS-CoV-2, that's the virus that call COVID-19 in Africa. What did we find? Yeah, we find that multiple variants have emerged in the African continent. So we are very aware of the Beta variant in South Africa. Many of your public will be aware of the C.1.2 that was described a few weeks ago. But what people will not be aware is that variants also emerge in Nigeria. They also emerge in East Africa, potentially in Uganda. And we also detect very, very mutated variants from travelers from Tanzania. Yeah. So what is that saying us? What is saying us is that if the pandemic keep spreading in the African continent with very low vaccination rate, unfortunately not every country in Africa is as lucky as South Africa to have access to vaccines. At the moment, only 2% of the continent has been vaccinated. We do expect more and more variants to keep emerging. Yeah. And one of the big reasons why that, yeah, and one, it's what we know from around the world, is that if the pandemic keeps spreading and especially involve infecting people with a low immune system, the immune system cannot clear the virus, and the virus can evolve and fall in the population. So would it be a catastrophe if we were to keep detecting new variants in Africa every month, because Africa already have suffered not only with deaths, but economically from this pandemic.
All right. So one of the things we know, though, is that even if one is fully vaccinated, you can still catch COVID-19, what they call a breakthrough infection. Yes, it completely cuts down your chances of even going to hospital and almost totally eradicates the risk, though not completely, of dying. Does that also mean that it cuts down the body's or the virus's ability to mutate, even with someone who has contracted COVID but is vaccinated?
Yes, yes, Sally, that's a very important question, and the answer it is yes. What it means, people that is vaccinated, for example, we just heard in the last few days, Sia Colisi, our captain of the Springboks, highlighting that he caught COVID after vaccination, and within days he was back and could even go play an international game. So what it means, even if you can have a breakthrough infection, which is around 50% of people will have, you will clear the virus very quick, and the virus do not have time to evolve. So vaccines not only is going to avoid hospitalization, death, but also going to make sure that anyone that gets infected can clear the virus much quicker, and that give much less chance to the virus to evolve.
All right, that makes a lot of sense. I wanted to speak to you about the variants. The other variant, you mentioned the C.1.2, but also the variant, I don't know how to pronounce it, is it MU? M-U? A little bit more about that variant, and any other variants that you might be tracking or significant mutations. We know that the virus mutates all the time, but we're talking significant mutations. Of the ones that are sort of bubbling under, so to speak, which ones are you most concerned about?
Okay, thanks, Sally. So just for simplicity, I am part of the World Health Organization Virus Evolution Working Group. That's the organ. It's an international organ with only 30 world leading experts that look at variants across the world. The last one to enter the list of variant of interest is that one called the MU. This variant, so basically they get like consecutive Greek letters, so that's why it's called the MU. That one, it has mutations very similar as the beta variant, also as the one that we are keeping at bay in South Africa, the C.1.2. And that variant is causing around 30–40% of infections in certain countries in South America. At the moment, this is a variant of interest. We are very interested. We are looking at that, but we are not concerned. And one thing that we did yesterday after this publication of this Pan-African consortium, which was published in Science, one of the very important journals, we update the analysis on the whole continent with a date of a day ago. And at the moment, the really variant that worry us is still the Delta. It is around 98 to 99% dominating the infections in the whole African continent, and that's the one that we should be worried at the moment. There is 4 variants of concerns: that the Alpha, Beta, Gamma, and Delta, but the one that we are more concerned is the Delta. As soon any other variant become of concern, we will highlight to the world as part of the World Health Organization committee.
A very significant day today with Sinovac starting, I think it's its phase 3 trials. We know that over 40 to 60 million vaccinations have been given out to children in China already, but it started in 5 countries. South Africa is one of them. I'm wondering if we shouldn't be already vaccinating the 12s and over with the Pfizer vaccine that is happening in countries such as the USA and the UK, particularly as you talk about how if you can catch COVID and you're unvaccinated, you can incubate new variants. But if you've been vaccinated, even if you catch COVID, you'll clear it out of your system much quicker, less chance of a mutation. Shouldn't we be already vaccinating the 12-year-olds and up?
Yeah, thanks, Sally. Yeah. My honest opinion is at the moment, no. And the reason for that, if we go back to that same argument of if you are unvaccinated, you will give time to the virus to evolve. But what you know from children is that naturally they clear the infection much quicker than adults. Yeah. So, and my suggestion is that we don't need to vaccinate children at the moment in South Africa, because we really have to catch and we have to increase the coverage of vaccination, especially in the older old people, because that's the ones that are more likely to get disease, or the ones that have comorbidity, because they also develop disease. In relationship to South Africa being running a phase 3 trial of the Sinovac, we normally find a very positive thing that South Africa has some of the best clinical trials units in the world. As we do well in genomic surveillance, South Africa is a leading group in clinical trials. Yeah, and with with very strict safety measures. And normally when a vaccine go to phase 3 trial, it means that it's safety and have shown efficacious at a phase 2. So I think that's positive and would be good to run that trial, as at the moment with our big focus is to vaccinate the adult population.
All right, well, thank you so much for chatting to us this evening, Professor Tullio De Oliveira. He's Director of CRISP at the University of KwaZulu-Natal.